Stages of growth and development. The following sections discuss development by age group. Fully appreciating the scope of human growth and development involves examining a few aspects of development across a larger spectrum. Psychosocial development. Erik Erikson, an American psychoanalyst, viewed the life cycle as a series of developmental stages, each accompanied by a developmental task or challenge. Table 24.2 provides an overview of Erikson's stages of development. Many of the subsections that follow include stage-appropriate characterization according to Erikson's framework. Cognitive and intellectual development. Swiss theorist Jean Piaget's stages of cognitive development are outlined in box 24-6. Communication and language. Humans have an innate capacity to learn language. They are born with the mechanism and the capacity to develop speech and language skills. During infancy, the unique ability of the brain to sort out basic sounds and to extract from sentences the most meaningful elements becomes apparent. During early childhood, the brain's language acquisition ability becomes even more sophisticated. Parents and other caregivers have an enormous potential to influence the infant's intellectual and language development. Infants do not speak spontaneously. Interaction with the environment provides a means for them to acquire these skills. Speech requires intact physiologic functioning of the respiratory system, the speech control centers in the cerebral cortex, and the articulation and resonance structures of the mouth and nasal cavities. In addition, acquisition of language requires an intact and discriminating auditory apparatus, intelligence, a need to communicate, and stimulation. The rate of speech development varies from child to child and is related directly to neurologic competence and intellectual development. All children go through the same sequence of stages in language and speech development in early childhood unless abnormal conditions are present. Table 24-3 or 24.3. The basic sequence of language is as follows. At 3 months, babbling. When infants babble, they typically explore all the possible sounds they can make by enhancing the force of the airstream as it passes their vocal cords and by varying the positions of their tongue in their mouth. At 1 year, recognition of words. Between ages 1 and 2 years, infants generally acquire the ability to produce hollow phrases, one-word sentences that convey a complete message. Up. Infants learn to expand their hollow phrases by attaching them back-to-back to other nouns or verbs. They thus form two-word sentences. Mommy, milk. Daddy, come. Early speech often is referred to as telegraphic speech because, as in telegram messages, the articles, pronouns, prepositions, and conjunctions are omitted. In organizing and coding language, infants acquire an understanding of the most meaningful units of speech. No one teaches infants to use nouns and verbs first. They learn this sequence on their own. At preschool age, acquisition of structure of native language. The language explosion that occurs during the preschool years is most obvious in the growth of vocabulary, from 50 words at 18 months to 200 words at 2 years to between 8,000 and 14,000 words at age 6. From ages 2 to 6, the average child learns between 6 to 10 words per day. Preschoolers have an outstanding ability to learn language. Most researchers regard early childhood as a crucial period for language learning. At 6 years, ability to speak and understand new words and sentences. Even compared with the preschool years, language development from 6 years on is remarkable, albeit much more subtle as children consciously come to understand more about many ways language can be used. This understanding gives them greater control in their comprehension and use of language, and in turn enhances the range of their cognitive powers generally. A common rule of thumb about the evolution of early speech acquisition is that the number of words in an average response usually corresponds to the chronological age of the child. For example, a 2-year-old may say, "me do." A 3-year-old may add a word, "me do it." And a 4-year-old may say, "let me do it." Girls advance more rapidly in language development than do boys. Firstborn children develop language earlier than do later-born children. And children of multiple births, twins or triplets, develop language later than children of single births. Infancy. An infant's physical development happens so rapidly that size, shape, and skills seem to change daily. Growth, which proceeds in a cephalocaudal and proximal distal sequence, is rapid during the first 6 months of life. Infants are expected to gain about 1.5 pounds, 3.3 kilograms per month until 5 months. And infants usually double their birth weight by 4 to 6 months. By the time the baby is 1 year of age, the birth weight has tripled. Average weight is 21.5 pounds or 47.3 kilograms. Most of the weight gain in the first months of life is in the form of fat, which provides insulation and a source of nourishment to draw on if teething or other problems decrease food intake for a few days. After 8 months, weight gain includes more bone and muscle. Height or length increases by 1 inch, 2.54 centimeters per month for the first 6 months. By 12 months of age, the infant's birth length has increased about 50%. The typical length is 30 inches, which is 75 centimeters. Vital signs. Infants are subject to wide variations in body temperature related to activity levels and state of health. Apical rates slow in infancy. At 2 months, the average apical rate is about 120 beats per minute. At 2 months, the average apical rate is about 120 beats per minute. Count the apical pulse for a full minute, noting variations in rate, volume, and rhythm. Respiratory rates also decrease during infancy. These rates are related to activity level. Average resting respiratory rate for the 12-month-old is about 30 breaths per minute. Blood pressure readings gradually increase to 90 to 60 millimeters per mercury at 12 months. Dentition. Teething begins at about 5 to 6 months of age. Signs of teething: irritability, edematous red gums, excessive drooling, and change in stooling. Begin 3 to 4 weeks before the appearance of the tooth. Box 24.7. Dental decay can begin at any time after tooth development. Oral hygiene for the young infant consists of offering sips of clear water and wiping and massaging the infant's gums. The American Academy of Pediatric Dentistry recommends that children have their first dental visit when the first tooth appears, but no later than the child's first birthday. Advise parents to begin toothbrushing after the first teeth appear. This element of dental hygiene is important to continue throughout the lifespan. In areas without added fluoride in the water, recommend the use of fluoride toothpaste to prevent bottle mouth syndrome. Instruct caregivers to avoid putting anything but water in the infant's night bottle. Sugar in milk, formula, and juice cause severe decay and destruction of the tooth enamel. Also, instruct all caregivers not to prop up the bottle and then leave the child alone with it, because this practice potentially leads to aspiration. Furthermore, holding the infant during feeding provides warmth, comfort, and bonding, all vital factors in providing a feeling of love and security. Motor development. At 2 months, the infant can hold the head up while in prone position. By 4 months, the infant can hold the head up steadily to a 90-degree angle while in prone position. At 6 months, most infants can balance the head well. By the end of 7 months, infants have acquired the ability to sit up steadily without support. Locomotion. Crawling, an early form of movement, is a motion made with the infant's abdomen touching the floor. A more advanced form of locomotion is creeping. The infant accomplishes this by resting the weight on the hands and knees. Infants sometimes crawl at 7 months and creep at about 9 months. Creeping appears after age 9 months in most children. Standing with support and walking follow at about 8 months to 15 months. Psychosocial development. Erickson defined the task of the infant as basic trust versus mistrust. The responsiveness of others to the needs of the infant helps establish the basis of trust. Infants obtain gratification when their basic needs are fulfilled. Infants whose needs are not met develop a sense of dissatisfaction or mistrust. For an overview of Erickson's stage of psychosocial development, see Table 24.2. Cognitive and intellectual development. During this stage, the infant uses the senses to learn about self and environment. The infant learns with exploration of objects and events with interaction. Piaget describes the infant as being in the sensory-motor stage of cognitive development. In the sensory-motor stage, an infant's knowledge comes about primarily through sensory impressions and motor activities. Behavior is completely reflective. The infant develops an image or schema. An innate knowledge structure that allows a child to mentally organize ways to behave in the immediate environment, and assimilates and interprets the information. Infants learn by encountering and responding to stimulation from the environment. As the infant interacts with the environment, changes occur in the mental structure and in the development of thinking ability. During the first 1 to 4 months, the infant follows objects visually with the eyes and auditorily with the ears. By 4 months of age, infants become notably better at using both eyes together, which makes them more astute observers. From 4 to 8 months of age, the infant begins to recognize and imitate. Reaching and grasping are improved skills. By age 3 months, most infants respond differently to their parents or primary caregiver than they do to other people. By age 4 months, many infants can identify the voices of most familiar people in their lives. Smiling occurs in response to different people and events. At the sight of their parents or primary caregivers, infants smile and begin to vocalize. Students and children ages 15 to 30 months who had good attachment relationships showed that they experienced a predictable behavior pattern after separation, known as separation anxiety. Beginning at approximately 8 months of age, infants show this anxiety when they are separated from their primary caregiver. They develop shyness and a fear of strangers. The infant may cling and protest any separation from the primary caregiver. By age 9 months, most children show alarm at the presence of a stranger.